after the session. Second, we will have dedicated Q&A sessions toward the end, but feel free to submit your question at any time using the Q&A features. Third, please make sure your microphones remain muted during the sessions to avoid any background noise. Now, let's dive in. Ladies and gentlemen, it's my honor to introduce our distinguished panelist of the day, Dr. Yazli Yuhana. Dr. Yazli Yuhana is a highly respected associate professor in infectious disease and internal medicine. With an illustrious career spanning over 2 decades, Dr. Yazli has made significant contributions to the field of medicine, particularly in infectious disease and clinical tropical medicines. Dr. Yazli Yuhana's academic journeys begins with a Bachelor of Medicine and Bachelor of Surgery degrees from the Royal College of Surgeons in Ireland, RCSI. He continued his medical and surgical internships at Beaumont's Hospital Dublin and Our Ladies of Lourdes Hospital in Dockheader, Ireland. He then pursued a Master of Internal Medicine at the University Malaya Medical Centers, Malaysia. Dr. Yazli further specialized with clinical fellowships in infectious disease, training at prominent institutions including Sungai Buloh Hospital, Kuala Lumpur General Hospitals, and the National Heart Institute, as well as the Hospital for Tropical Medicines at Mahidol University in Thailand. He crowned his academic pursuits with a PhD in clinical tropical medicines from prestigious Mahidol University. In his professional career, Dr. Yazli has served in various esteemed roles. He is currently serving as an infectious disease resident consultant at KPJ Ampang Puteri Specialist Center and a visiting consultant at Columbia Asia Hospital in Klang, Malaysia. Notably, he has been a key figure in the UITM Clinical and Training Center's Infectious Disease and Antibiotic Stewardship Program. His expertise in infectious disease has also earned him a place as a member of the Asian Pacific Rickettsial Network under the Mahidol Oxford's Research Unit. Dr. Yazli's research contributions are extensive and impactful, focusing on infectious disease such as leptospirosis, rectal infection, and HIV. He has been the principal investigator for multiple research grants, including those funded by the Wellcome Trust of the United Kingdom. His work has been published in numerous reputable journals, shedding light on neglected causes of acute febrile illness and improving the diagnosis and treatment of infectious disease. Currently, he is a lifetime member of the Malaysian Societies of Infectious Disease and Chemotherapy and an active member of the Malaysian Society of HIV Medicines. Dr. Yazli's dedication to the medical fields and his contribution to both clinical practice and research make him a valuable asset for our webinar today. Please join me in welcoming Dr. Yazli Yuhana. Doctor, the floor is yours.
Thanks, Edson. Edson Law. Your name is Edson Law or Edson Madsen?
Edson Law.
No, just kidding. Okay, I thought you did.
Okay.
Right. Thank you, University Malaysia Sarawak. Okay. For asking to talk about pathway in internal medicine. Okay. First of all, you guys are lucky to be in Sarawak because there's a lot of potential with regards to what we know and what we don't know when it comes to infection. Kalau I talk about infection point of view, okay, Sarawak is untapped, means there's a lot of things that nobody else in the whole wide world are facing. Okay, there's a lot of medical issues, especially infections. Okay, that is still unknown. Okay, that we never see. Okay, Plasmodium knowlesi, nobody knows about Plasmodium knowlesi. Even orang Thailand, orang Myanmar, okay, orang Africa, they never know about this kind of malaria. What I'm saying, you are in the right place, okay, at the right time, okay, where you punya interest, okay, can really be polished from now, from the undergraduate level, okay, and pursue and make it a cita-cita, okay, to become a good physician or researcher dalam bidang-bidang yang negara lain tak ada, okay, especially when it comes to infectious disease. Just imagine we have been living with dengue for 100 years, okay, but until now we don't have treatment for dengue. I'm sure korang dah boleh tengah buat ubat from daun betik, okay, from sup ketam, okay, that's the best that we can offer, okay. But until now we never have a good medicine to cure dengue, okay, just because in the developed countries, negara-negara yang buat ubat, tak ada dengue, okay, just because there's no dengue in the States, okay, there's no dengue in the Europe, okay, so research in terms of this tak ada, okay, so there's a lot of potential in the future, okay, when it comes into what can we do, what kind of doctors we want to be, okay. So basically malam ni you guys panggil untuk kita dengar cara-cara nak jadi pakar dalam bidang internal medicine atau perubatan dalaman, okay. So there's no slide, okay. I just talk. At any point you have question, just ask, okay. So senang, right, okay. I'm sure you guys dah go through the subspecialty, okay, when it comes into medical student, all right. But trust me, it is not the real thing before you kerja, okay. Bila kita kerja, baru kita dapat the real experience, okay. But while you are a medical student, you need to have a feeling, okay. You must have your own feeling what kind of doctor you want to be, okay. In the end of the day, you must be somebody, okay. You cannot be a doctor biasa-biasa, okay. What I'm trying to say, kepuasan dalam menjadi doktor is when you are at the pinnacle, okay. I'm not saying we are at the pinnacle, but when you are at the top of your career, okay, you can manage your patients on your own, okay. That's the best experience when it comes to becoming a doctor, okay. Maksudnya, don't get me wrong, okay. To become a good doctor, you must become a good team worker, okay. But being a good team worker doesn't mean you always need other people to help you, okay. So by that I mean, in the end of the day, in your career, you must be independent, okay. You must boleh on your own self manage the patient from A to Z, okay. Of course you need your colleagues to help, but what I'm saying is that's a good doctor, okay. You can be reliable, okay. You are reliable on your own, all right. And to go there, you have to go through a lot of experience, okay. Don't get me wrong, experiences are going to be the most important thing in your life from now on, okay. But what I'm saying is, now as student, determine what kind of doctor you feel like you want to be, okay. So internal medicine is huge, right? There's like 12, 13 subspecialties under internal medicine alone, okay. In the end of the day, if you graduate as internal medicine specialist, it's not over yet, okay. You can't just be practicing general medicine until bila-bila, okay. Yes, it's fine to stop there, but again, the kepuasan tu tak ada, okay, because you manage your internal medicine case. The infection can be very bad. You still need you still need to ask your infectious disease colleague to help, okay. The chest pain is very bad. You need to do angiogram. You still need to ask your cardiologist colleague to help. Kidney koyak, okay, patient tak pass urine. You need to still ask your nephrologist colleague to help, okay. Susah nafas, you don't know kuman apa dalam ni, the only way is to bronch, to see apa kuman hiding in the lung, you still need to ask your respiratory physician to help. So in other words, be the end of the thing punya. Maksudnya try to be somebody at the end of that, so people are looking for you to listen to you, okay, to hear how you manage, okay. That should be your aim. That should be everybody's aim, okay, if you decide to be a doctor, okay. Don't get stuck, okay. If you get stuck, yes, you may like it, okay, but to me lah, in my personal opinion, I tak puas hati, okay, sebab kita tak boleh manage betul-betul, alright. But don't get me wrong, you will need help, okay, but in your own specialty, you would know what to do, okay. You will still ask your friends for opinions and whatnot, but most of the time you can manage yourself, okay. That's the aim of becoming a true doctor, okay. I'm not saying tak yang lain tak true. What I'm saying is kepuasan dalam pekerjaan, okay. In the end of the day, if you practice medicine, it's not going to be your career, it's going to be your life, okay. Your life defined by that, okay. Your life defined by how you treat your patients, okay. That's your life in the end. You tak nampak dah this is a job, this is career. No, it's no longer to be like that, okay. You nampak this is what you do, this is what define you, okay, and you must do it properly, all right. That's the introduction, okay, in internal medicine. All right. So far, any question?
Doctor, here we receive questions.
Yes.
The question is, Doctor, what inspired you to pursue a career in medicine, and how did you decide to specialize in infectious disease and clinical tropical medicine?
Okay. So I don't like to see my patient dying without we can offer the best, right? What I'm saying is, in infectious disease, if we know what's the organism causing the problem, okay, most of the time we can save the patient's life, okay. Berbeza dengan sakit jantung, okay, you need time to go there to do blah 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 and then unclog, and then it takes time for patient to stop smoking apa semua. And I don't like the messy things, macam tu lah. That's me, okay. So personally, I like to know what's the organism, what's the problem. Then we try to use every investigation that we can use, okay, using the head, okay. And then we treat properly, and you can see how patient turn, okay, to become so much better tomorrow, okay. If they not die that night, they will, I mean, if you mess up, they will die that night, okay. You know you're messing up with your patients, okay. So if they're okay that night, they will be much better tomorrow, okay. So that's the kepuasan that I get from infectious disease, okay, because the whole idea of treating the organism makes the patient better is what drives me to become to be a doctor, okay. So that's the early motivation, all right. And if you ask your consultant, okay, in Malaysia, when it comes into infectious diseases, it's all related to HIV, okay? Not that I don't like HIV, okay? But HIV is like the bread and butter of infectious diseases in Malaysia. But when we ask about, what about leptospirosis, okay? What about Plasmodium knowlesi, okay? What about rickettsial infection, okay? We don't know much, okay? Maksudnya, we might agak-agak, okay, this is how they present, okay? But we, in detail, we still don't know much, okay? Hence, that's the trigger for me to do my doctorate, okay, in tropical medicine, okay? Because I think in Malaysia, apart from penyakit diabetes or hypertension, okay, infection from tropical diseases is a lot, but we don't know much, okay? We don't know much. So that's why I did my PhD there, okay, in rickettsial infection, okay? So it's something that that's still potentially killing our patient, okay? Kalau kita tanya, boleh tak rickettsial bunuh patient? Ramai doktor akan kata, ada ke rickettsial in Malaysia, okay? That's one thing, okay? Nombor tu, boleh ke rickettsial bunuh? Okay, boleh, okay? So, but if you don't do this kind of study or work, okay, we will never know. Okay, we will always agak-agak. Okay, based on Thailand study, dia ada macam ni. Tapi we can never use Thailand study to menggambarkan apa terjadi dekat our Malaysian population. Okay, so the lack of interest in tropical medicine among infectious diseases physician makes me want to do, okay, tropical medicine. Okay, but the whole idea of why I want to become, why most physicians why physicians want to become physicians, because we can treat them, okay, using medicines, all right, and they should become better fast, okay, when it comes into infectious disease. By giving the right antibiotic, right antifungal, right antivirus, they become so much better faster, okay. So that's why I like infectious diseases, okay, compared to other specialties, all right. I hope that answered the question.
Yeah, thank you. That's a follow-up question. Can doctors share a defining moments or particularly challenging experience during your medical trainings that reinforce your decisions to pursue this specialty?
Oh, right. That's a very deep question. Okay. True and true, medical is complex. Okay, internal medicine is complex. The complexity is so complex that when we come to a patient pun become blur. Apa penyakit dia ada ni? Okay, I got SLE. What the hell is SLE? I got HIV. What the hell is HIV? I got blah blah. Okay, so I see that as a challenge to become a good doctor. Okay, so you try to make the complexity of internal medicine become so simple, okay, that patient appreciate the illness. Okay, they get lung cancer, but they're fine with it because they understand what's going to happen after this. Okay, so every subspecialty in internal medicine is so different. You need to use different kind of brain thinking. Okay, so that's the nice things about internal medicine, because you nak nampak patient you seronok, patient you puas hati. Okay, so you make a proper diagnosis. But that's not the most important thing. The most important thing to explain to the patient apa penyakit yang dia ada. Okay, especially complicated internal medicine issues. Okay, so internal medicine is complicated, but a good physician will make it so simple. Okay, that physician will listen and appreciate your presence. Okay, and follow your management and treatment. Okay, so they become better. Okay. Better means not necessarily not dying, okay? Because most of the time in internal medicine, you deal with chronic issues that might cause dying, okay? But part of internal medicine is palliative care. Okay, palliative care is a specialty that is so very artful. Okay, in the end, patient know it's okay to die. Okay, so palliative is part of internal medicine. Okay, if you do internal medicine, you will go through palliative care medicine. Okay, so in other words, internal medicine makes you I would say a better doctor, okay, because you start from A until Z. Okay, so and a good physician, a good internal medicine specialist, a good physician, okay, will do their job properly from the beginning until the end. Okay, that should make you become happier, right? More fulfillment, okay, when it comes into that. Okay, so what makes me want to continue the pursuit of becoming internal medicine specialist is the day-to-day challenge. Every day the disease is going to be different. Every day the patient is going to be different. Okay, you have dengue like this, tomorrow you have dengue like that. Every day is not going to be the same. Okay, so internal medicine is not boring. It's very dynamic. Okay, especially infectious disease. Okay, very dynamic. But that dynamicity should challenge us. Okay, to become better every day and every day. Okay. So that carries fulfillment lah, all right? So there's no particular momentous event that makes me want to pursue this. It's more of every day. You make sure that every day you become better in that disease, okay? So that a day after that, your management is different, okay? So because you will never see the same person with the same dengue, the same person with the same lung cancer, okay, the same person with the same blood cancer, the same person with the same chronic heart disease, okay, it's going to be different, okay? But that's the art of internal medicine, okay? You make them happy with their disease, okay? You treat them, they get cured better. But most of the time, the diseases are not going to be cured, okay? Except few infectious diseases, okay? But most internal medicine issues are going to be chronic, okay? So that's why you need to teach them, to tell them how to live with that, okay, so that they live with a more fulfillment life, okay, with more functionality in their life, okay. You want that in your patient. I hope that answers.
Yeah, all right. Thank you, doctor. Just now we are talking about journey and inspirations on becoming a internal medicine specialist. Moving on, maybe doctor can share about the academic background, which we heard that doctor have great background just now.
Yes, I mean, academics means, with a good academics background means you can be trusted to be mentally prepared in terms of reading, understanding complex researchers. Okay, that's what I mean by a good academic background. Okay, if you have a good academic background, means I can trust you to read this stuff. I can ask you to have a good discipline when it comes to coming to ward rounds. Okay, it means you are reliable in a sense. Okay, but never put a good academics background into a good doctor. Okay, that doesn't mean anything. Okay, a good academic background doesn't mean you're going to be excellent doctor. No, most probably you would be, okay, because you have the discipline and whatnot. But a good doctor simply means personality wise, okay, which cannot be accessed by your academic background. Okay, personality wise, there's nothing that reflect you're going to be a good doctor. All right, this is something that we don't teach at school. Okay, this is something that you cultivate when you are a medical student. Okay, you already decide, I want to become a good doctor. That's how you learn. Okay, personality wise, that's how you learn how to cope with stress. That's how you learn how to cope with pressures from colleagues. Okay, pressures from patient yang marah, tak sabar. Okay, that you don't do that in your SPM or whatnot. Okay, but those are the things that you must do now while you are medical students. Okay, that you must polish yourself, prepare yourself. Okay, this is what you're going to be in the next future. All right, if you just simply follow the flow, okay, do that, this, that, that, but you don't develop yourself, your own self, it's going to be challenging when it comes into the real work life in hospitals. Okay, that's why I'm trying to say. Yeah, but we know if you have good academic backgrounds, I can trust you. You are reliable to read. You are reliable to understand the complexity of this disease. Okay, I would expect you to understand why the pathophysiology. Okay, because you can think properly. Okay, but thinking properly during SPM doesn't mean thinking properly during undergraduate. Doesn't mean thinking properly during your specialty training. Okay, this thinking properly is the art in medicine, especially in internal medicine. Okay, how you think, okay, will define how you are as a good physician. Okay, that is something that we don't teach and we cannot teach. Okay, that is something that you learn from the patient. Okay, from your reading, your reflect, from your experience treating. Okay, that is something that's so valuable. Okay, and then don't waste those experience. Okay, so decide if you want to be this doctor, develop that particular skill. Okay, because that kind of skill you cannot get from other different specialty. If you want to become a surgeon, okay, there's no point of being good in terms of getting deep to know your patient, the way they are thinking so that they can reflect in their disease. Okay, no, what I'm saying is a surgeon must be good in their skill. Okay, but a physician must be good in their way of thinking. Okay, so that differs. Okay, but everybody need each other. Okay, but if you decide to be this particular doctor, polish your skill there and then. All right, so that I'm not saying wasting of time. Okay, but in the end of the day, you are going to be a specialist. Okay, so start to think and behaving like one from now. Okay, so that you become a better specialist faster. Okay, by faster means you get the necessary knowledge and skill that you want. Okay, that's important. All right, so yes, because in medicine you must read. Okay, you must read. Okay, and textbook doesn't mean it's true. Okay, what you read today. When I was in medical school, we never learn about COVID. We never know what is SARS-CoV-2. Okay, until COVID come, it's like a new medical school. Okay, that 2 years time is a medical school for every doctors on how to manage COVID. Just imagine that's the best example of what doctors like to be. Okay, you need to be prepared on new things. Okay, so if you have a good medical academic backgrounds, mean you like to read, okay, you like to observe, okay, you like to think, okay. So that is nice, okay, when it comes into new diseases like COVID, for example, okay, you penat-penat kerja, you still ada keinginan balik baca journal, okay, this is what happened in China now, they use this, they use that, this is what happened in Italy, okay, they use this, they use that. So you still have time to help with the improvement of your knowledge, even then, okay. So but I tak adalah excellent sangat. I'm okay in terms of the results. So, but I don't think those define me now. Okay, I have a lot of friends with straight A1s. Okay, top 10 in the whole country, the whole SPM top 10. Okay, but I'm not saying they are not good now. Okay, although we all do medicine. Okay, but most of us don't dwell into this subspecialty. Okay, most of us just start somewhere. Okay, not to say 100% in medicine. Okay, what I'm saying is, yes, that defines your journey to become a good doctor, but to becoming a good doctor is during the process of your study and the process of your working. That's when you really need to put your foot down. I want to become this, and you go all out by doing that. All right. Does that answer the question?
Yeah. Doctor, we just received anonymous questions. The question is, why don't doctors choose to become a surgeon? Because in usually publics will think that surgeon like a hero rather than internal medicine.
Okay. Number two in medicine, or in any general life, not just in medicine. Okay, you don't try to impress others. Okay, just because people think like this, you want to become that. Just because you want to make you feel good, to be perceived, to be seen by society. Okay, never do that. No matter what you are, engineer ke, lawyer ke, medical ke, whatever lah. Don't do things just because publics want you to be like that. Just because you want to be seen by public like that. That's not just going to fail you, okay, but it's going to make you feel tired, okay, because the whole time you will never chase the you want the accreditation by people around you. That's not going to be working, especially in medicine. If you do medicine, if you do such specialty just because others, okay, you will not enjoy it, okay? You will not enjoy it. It's tiring. You will feel the fatigability of that, okay? Internal medicine is tiring, okay? Not physically, but mentally, all right? So do things because you want to do it, okay? I know I hate going to be in the OT, okay? The only time I like to be in the OT because I want to see how people wash their hands, okay? Infection control, okay? But I hate standing in the operating theater. I hate standing and focusing doing things, okay? That's not my personality, all right? So that's why one of the reasons I know I'm not going to be a good surgeon, okay? I'm good with skills, okay? Don't get me wrong, okay? When we do masters, I'm good with central line. If that calls skill, I'm good with putting the invested things. So I'm good, I'm fine with skills, okay? There's nothing wrong with it. But I don't see myself doing that for hours and for ages, okay? I don't see that. Hence, the gut feeling, okay, you must have your own gut feeling when it comes into this, because that's going to be you, okay? Do you think you're going to be okay living that kind of life, all right? And once you think no, then the answer is no, okay? Don't think much, because you will never become a surgeon and then decide I don't want to become a surgeon, okay? So you only have the chance once in your lifetime, okay? Once you have become the specialty, that's going to be your life, okay? It just depends on how you want to live with that, okay? You want to resign early, fine. It's a waste of time, right? So that's why I said such specialty, you really need to have the feeling, okay? So do I want to do this, all right? Otherwise, don't do it, okay? Don't expect society to dictate how you're going to live your life, okay? That's not nice.
Yep, I do agree with doctors because it will be too tiring if we do something that we don't like.
True.
Moving on to the next question. Could doctor elaborate on the education and training milestones that are crucial for someone aspiring to specialize in internal medicine?
Right. Internal medicine is all about experience, okay? Experience treating patients. So don't rush. Don't rush, chase after your exams. Fine, you sit for your exams, make it pass, okay? Ace it, pass it, that's fine. But that's not going to define you as a good physician, okay? A good physician is all about having the experience, managing your patients on your own most of the time, and you can see the difference, okay? That's a good physician, right? So take your own time means don't waste your time, but every day you must learn from your patients, okay? That's how a good physician is, okay? You learn from your patients every day, because trust me, once you are a consultant, you're still learning, okay? There are still things new to you that you might not jumpa waktu you training, whatnot, okay? So, but that doesn't mean that you're going to be bad, okay? The experience will teach you how to manage complex, difficult cases that you haven't seen, that you have read, that you haven't seen. So the experience of doing it will guide you through your journey of while you are a consultant. But what I'm saying is, there's no such thing as milestone. Every day is a milestone, okay? Every day you must learn from your patient, okay? Like I said, there's no similar disease in a similar person, okay? Everybody will behave differently. So learn from that. That will be your milestone, okay? Every day, every hours, in fact, is your milestone of becoming a good physician, all right? But in general or in academic point of view, okay, there are two pathways in Malaysia, okay, either a Master of Internal Medicine, MMed, or MRCP, okay, the Royal College of Physicians Medical Associate, okay. There are only two accredited program, okay, that KKM recognized. Why I mention this? Because lo and behold, if you want to practice in Malaysia, you have to go through KKM. Okay, so you must listen to their rules and regulations. Okay, so the Kementerian Kesihatan Malaysia dictates you must have either MMed or MRCP. All right, so it doesn't matter which one. Okay, but in MMed, okay, now, so MMed has traditionally been structuralized nicely. Okay, that every one of the candidate will go through every subspecialty under the supervision of good consultant. Okay. So that's why I'm saying. So you are, in other words, belajar betul daripada the good doctors, okay, from the good center, okay. So that's MMed, okay. If you are into MMed, never try to leave the program. It's super good, okay. It's super good, okay. I learned a lot of medicine in Malaysia compared to when I learned in my undergraduate, okay. I don't think I learned much in undergraduate, okay, but the subspecialty training is superb, all right? So if you have a spot in Master of Medicine, okay, because you want to become physician, don't waste it, okay? Do it properly. Go through all the 4 years journey, 4 years, all right? Because that will teach you so much when it comes into internal medicine, all right? But if you don't have the spot, because the spot for MMed is limited, okay, that year only certain university will allocate certain numbers, okay? You don't have much center to train, okay? Fine. Sit for the MRCP, okay? Because as long as you work in the hospital under supervision of KKM, right, you're going to be assured that you're going to be going through all the subspecialty training, okay, with the reliable consultant, okay? So you will have a good teacher, okay, with the training. So that's the MRCP, okay? So in other words, you need to be a bit flexible when it comes to MRCP, okay, because your hospital must have this specialty, otherwise you need to continue training in other hospital, okay. So that's the so-called parallel pathway program, okay. So the MRCP, but both are equally good when it comes into the exposure, all right. So all we want is your exposure through the all subspecialty in internal medicine, okay. 6 months of cardio, 6 months of respi, 6 months of hematology, okay. Only 2 months for infectious disease, okay. If I'm the Minister of Health, that's what I want to change, okay. So 1 year for infectious disease for all MMed and MRCP. I'm just kidding, okay. But only 2 months for infectious disease, which doesn't make sense to me lah. So infectious disease is very heavy in terms of the gravity of illness, okay. I'm not sure why I talk about that now on this platform, but there you go, okay. You need to go through all these subspecialty trainings, all right. Your milestone is when you pass exam. Try not to fail exam in your MMed or MRCP because it feels lousy, okay? It feels lousy, trust me. When it comes into exam, that's the only time I say that, okay? Because other exam, I don't mind, okay? It doesn't feel nice if you fail your MMed exam or MRCP exam because I don't know why, okay? Because once you are in your subspecialty training, I think you are on the way of becoming a reliable doctor, okay? And you should not fail exam through and through because that reflects how are you going to be when you become a physician, okay? Because to me, as cliche as it sounds, there will be a difficult question every day, okay? Every day you will face difficult question in internal medicine, okay? From your patient, from real life, I'm saying, So just put that into perspective. Exam might be like that, all right? So you should not fail, okay? So a good milestone, I'm not to say you failing your exam, but there you go, okay? So since somebody mentioned milestone, okay, a good milestone is you pass through all your major exams in your Master of Medicine or in your MRCP, okay? Just because it shows how prepared you are when it comes into situation like this, okay? Because you need to be prepared whenever it comes into life-changing situation, okay, life-changing question, okay, you pass your exam, suddenly you got called 12 midnight, how to save this patient die tomorrow. I think you fail, okay, because you did not manage to make a diagnosis that night, okay, that to me is the real milestone, okay. But it's okay to fail if you fail, okay, but don't fail again, so that's the only time I talk about failing in exam. In other exam, I don't care, okay, because it doesn't reflect how are you going to be how you be functioning, right? But in MED and MRCP exam, I think you should ace it, okay, because once you are in the program, you already train, okay, to face difficult situation. Okay, exam is difficult situation, just like everyday's life when you become physician. Every day is difficult situation. Does that answer the question? I think I hope it does lah.
Yeah, thank you for answering the question, Doctor. The next question is, we know that Doctor having internship and fellowships in Ireland and Thailand. So may we know that how did the internships in Ireland and fellowships in Malaysia and Thailand contribute to a development as a specialist? And what is the difference between the internship in Ireland and housemanship in Malaysia? Yeah.
I always say this, if you survive houseman in Malaysia, you're going to be a reliable doctor. Okay, I always say this, okay, because my experience as a junior doctor totally tak sama with the junior doctors in Malaysia. Okay, you have more experience in Malaysia, you have more patience in Malaysia, you have too much, okay? In fact, you have too much, okay? I don't think it's fair. But if you manage to face that, salute, okay? Maksudnya you survive one of the most intensive, I don't say training, okay? I don't say housemanship is a real training because you need to train yourself, okay? In Ireland, I'll be made sure that I'll be trained, okay? So my mode of otak tak sama dengan doktor kat Malaysia. Dekat sana, I expect to be spoon fed, okay? I come to work, not to ambil darah, okay? Over there, we tak ambil darah, darah semua phlebotomist, okay? Semua itu, no, we are there to learn, okay? To continue our journey as student and to learn more, okay? But with gaji, okay? That's the only problem. Okay? In Ireland, you are paid to learn, okay? That's only different, okay? I don't say I don't learn anything, okay? The only thing is, yes, you will see good consultant in Malaysia. A good consultant means consultant yang sit down with you and teach. You need that kind of personality in your training, okay? You need a good figure to anchor you, okay? This is what I want to be. Okay, you need to have that. Okay, you need to have that feeling where this doctor inspire me. So the specialty might inspire you, but trust me, it's the personality that transpires you. Okay, you need that kind of guidance because you will never know what you want to be. Okay, so you need some kind of ideas. Okay, so right now, pay attention to your consultant. Okay, if you are inspired by them, means the specialty must be right to you, okay? Because you are inspired by how they talk to patient. You are inspired by how they talk to you, okay? You are inspired by how they think. So that in the end reflects what is inside you, okay? So you would become like that, okay? That is something that I got from Ireland, okay? So the consultants there, they don't want to teach you because they are asked you, but they want to teach you, okay? The way they behave, okay? So that's something that you might learn, okay? I don't think you can learn that much in Malaysia because you are so busy with other things. So that is something that is a little bit unfair, okay? But you don't have other options, okay? You just go through it, but I don't want you guys to go through your housemanship just because it's a housemanship. It's tedious, it's tiring, yes, but that's what makes you become better, trust me. But take a while to pause and reflect to your own colleagues, okay? That consultant is something that triggers me how to become, okay? So pay attention to that, okay? Because that is important, because that will actually guide of what kind of doctor you want to be, okay? No matter how busy you are with your housemanship. But yes, over there, I'm not that busy. We are, in fact, one of the richest junior doctors being paid in the whole Europe, okay? During that time. But if you ask me to do this or do that, I don't think I'm that competent. Okay, so if as want to compare to junior doctors in Malaysia, okay, same level. Okay, I don't think I will be that competent. Okay, and competency is very important. That's how your colleagues perceive you. All right, but no matter where you are, what you are doing, okay, use that particular experience to guide you, okay? Don't waste your time looking for other things in which you might not have the opportunity, all right? So just do it properly, okay? And you should be okay, okay? But again, reflect for a while, because your surroundings will reflect on what kind of doctors you want to be, okay? So pay attention to the doctors that inspire you, okay? And see whether the inspiration goes day by day, okay? If you keep being inspired by them, okay, I think that will be your call, your calling, okay? So that's what that kind of doctor is what you should be, all right? I hope that answers. So in Thailand is different, okay? Thailand is very Americanized, okay? They're very Americanized, although they don't speak English, but the consultants speak good English, okay? The junior doctors just know, hi, how are you? Sawadee okay? Sawadee kap. That's all I know, okay? But what I'm saying is the training is faster than us, okay? We are a bit British, okay? British ni lambat sikit nak training, okay? The Thai people are very fast in terms of training, okay? So if you go to conference, all the consultants very muda, okay? Because they are trained early. They have different system, okay? But again, they have more doctors, okay? The medical students are a lot, okay? In Bangkok itself, they have like 2, 4, 5, 6, 7 university hospitals, okay? In other words, the training ground is so much more than us, okay? And the training program is faster than us, okay? I'm not saying it's better or no, okay? But it's different, okay? So that's how I see how Thais are different than Malaysian, lah, okay? And they are very good in their tertiary care. Okay, that's what I learned in Thailand. Okay, so when it comes into tropical medicine, for example, they can do everything. Okay, PCR, serology, you name it, they can do it. Okay, you might not have that access through that hospital, but you will have access through the major reference lab, major reference hospital. Okay, we do have that kind of thing in Malaysia. Okay, but it's pretty much limited. All right, but there you go. Okay, that's the experience that I got from Ireland and Thailand.
All right. Just now, Doctor got mentioned about competency, right? So, Doctor, do you have any advice for students seeking fellowship opportunities, particularly in a competitive field?
I don't get that question. So, my advice on what?
My question is how to survive in a competitive field.
Just be yourself. Okay? The last thing you want to do is do whatever and because other people ask you to do. You pretend to be somebody else, you're not going to make it well. Okay? In whatever you're doing, okay? Be yourself. By being yourself at this point of time, you know this is what you want to do. Okay? You're not pretending to like the training. You're not pretending to like the specialty. It's okay to hate the specialty. It's okay to hate the specialty, not the doctors. Okay, you never hate person. You hate the person do. Okay, it's okay. It's okay to hate that because that's what. If you are me, I hate doing operation. I hate doing surgeries. Okay, I hate. Not that I don't like. I hate. Okay, so I'm fine. So whatever fellowship that you asking means you have an idea that this is what you want to be. Okay, but that doesn't mean that you're going to like it. Okay. But that means a lot because not everybody will have the opportunity to go through such fellowship, right? But if you like it, you really like it, not because you pretend to like it. Your supervisors like you, okay, just because they see that you are going to do well in this program, okay? You're going to have a faster track compared to your other colleagues. Okay, means you're sitting an exam. Okay, you will have a spot to be trained in that center because that particular place know you already well. Okay, that's the benefits of getting into such exposure when you really know that you want to do it. Okay, so do it properly. All right, but if you don't like it, try to ask yourself why you don't like it. Okay. And in the end of the day, only you know why you don't like it, okay? But not because the academic reason, okay? Not because all subspecialty will have their own gravity in terms of the academic requirement, okay? So all of you start with the same thing, okay? It all depends on the nature of the disease, okay? I hate stroke. I hate neurovascular. Okay, so I hate thinking about the pathophysiology, what happened in the brain. Okay, in the end, the treatment is the same, MRI. Okay, so just because of that, I don't like the complexity of neurology. Okay, just because in the end of the day, there's nothing much that I can offer to my patient. Okay, that kind of thing that you need to learn during your program. Okay, what kind of thing that you could offer to make your patients better. Okay, you don't do that in your hospital every day, but in a fellowship program, you will see that. Okay, if you see yourself doing it, making your patients better, okay, you happier, right? Then that fellowship is for you. All right, so you should see how you contribute in that particular program. Okay, so in your specialty in the end, right?
All right, thank you, doctor, for good advice, I think. So, doctor, in your experience as an infectious disease consultant, what are some of the most challenges you encountered in diagnosing and treating the infectious disease?
What kind of what?
What kind? What are the most common challenges you encountered in diagnosing and treating the infectious disease?
They are all the same. Okay, everybody come with fever. So they all come with fever, but all infections come with fever. Okay, that's the biggest challenge. Okay, a good infectious disease can make a good diagnosis just from asking, okay, and from seeing the superficial bloods. Okay, otherwise you become like other doctors, physician. You send everything. Okay, fever aja, dengue, NS1, marburg film, lepto, IgM, blood culture. To me, that's not nice. That's a waste of resources. Okay, that's a waste of money, not to mention. Okay, you can tembak semua penyakit and tunggu result. Okay, that's not nice. Okay, so to answer Edson question, the challenge is to make a good impression on the disease, to start on the proper treatment on that particular time, and see how they respond, so that your other colleagues see this is how you manage infection. Not just everybody hentam with a broad spectrum antibiotics. Everybody hentam with this kind of investigation. Okay, so it takes a good thinking on how to diagnose infectious disease. Okay, because the presentation is almost always like ada kuman. Okay, dengue will present like malaria. Malaria will present like melioidosis. Melioidosis will present like lepto. So what the hell? Okay, so but there is the skill that you require by asking, examination, okay, the pattern of bloods, okay, that's the challenge in infectious disease day by day, okay, and not to mention to guide your other colleagues on how to use antibiotics properly, okay, because that's the biggest challenge if you ask me. Okay, we have antibiotic that's so broad spectrum, kill everything under the sun, but are we going to nuclear bomb everyone? No. Okay, so that's another challenge. Okay, using antibiotics properly. Okay, to me that's a challenge lah.
All right, the next question is from our audience. Can I know how long the duration that doctor have gone through to become who you are until today? From undergraduate until today, yeah, that's the question.
I am still learning of who I am. Okay, you never stop learning. Okay, once you think I know everything, then something wrong with you. Okay, you will never stop at learning. Okay, you never stop at growing. Okay, every day is something that you should become different. Okay, if you just like this every day until you die, that's a problem with you. Okay, so I'm still we still, okay, there's still a lot of things that we don't know in medicine and in infectious disease. All right, so by saying that, I forgot the question. What?
I repeat again, how long the duration that doctor have gone through to become who you are today?
Okay, so if that question means how long will it take to become a
Specialist, I think.
specialist in infectious disease, okay, so
Yep.
5 years undergraduate, 4 years of training in internal medicine. Okay, before you become cardiologist, nephrologist, chest physician, hematologist, palliative specialist, okay, rheumatologist, infectious diseases. Okay, there are 13 subspecialties under the umbrella of internal medicine. You have to go through 4 years of training. MRCP pun 4 years, Masters of Internal Medicine pun 4 years. Okay. 4 years too, you will go through all the subspecialties. All right. So to me, that's enough. Okay, that enough to expose. Okay, this disease exists. This kind of patient exists, but that doesn't stop after that. Okay. So academically, okay, 5 years undergraduate, 4 years of specialty training, and 3 years of subspecialty training. Okay, subspecialty training, for example, infectious disease. Okay, 3 years of just purely infectious diseases. Okay, you don't see any other thing. But that doesn't mean you forget how to treat hypertension. Okay, that doesn't mean you forget how to treat diabetes. Okay, you still see that every day. Okay, but that 3 years alone, you just focus on fever, microbiology, lab. Okay, that's good. To me, that's nice. Okay, so all in all, from undergraduate, 5 plus 4 plus 3. Okay, 12 years to become who we are today. Okay, but that's what I'm saying. After that, even still, you need to do your own research, your own things on how to make yourself better doctors. Okay, academically, 12, 13 years. Okay, but but truly, okay, it never stops. Okay, the journey of becoming a good doctor, a better doctor, never stops. Every day you just need to improve yourself to become better than before. So in the end of the day, you can smell the disease from outside. Okay, that's when I tell you are already good in your job. Okay, you can tell from the end of the ward, okay, this is dengue. Okay, this is lepto. Trust me, you will get there, because the experience will teach you how to do that. Okay, not just because from your textbook and whatnot. Okay, you can see. Okay, this is how the disease presents. This is how the patient will complain. Okay, this is how the exposure will be. So all of that will make you become a good physician. Okay.
All right. From we step into the medical field, we know that being a doctor is a lifelong learning process. So, doctor, how do you stay updated with the latest advancement in your field, and what resources do you recommend for continuous learning?
Right. Okay. There's a lot of things that you must know. So you cannot do that. Okay. You cannot do that. So hence, you just need to decide to be good in what. Okay. You decide to be good in infectious disease. There's a lot of things that you need to read in infectious disease. You decide to be good in this disease. Okay. So you only have this disease to be updated. Because you know, you have your friends of lepto. You can call, hey, what is the current treatment of leptospirosis? You know what I'm saying? Okay. In the end of the day, you just need to be good in your niche, because that's how people will ask you. They know I'm a physician, but nobody will call me with chest pain. Nobody will call me with shortness of breath. But they know we know how to manage, we know how to diagnose, but nobody will ask your advice, because we can understand. Okay, I will not pick up the phone and ask them, how do you manage dengue? Okay, but what I'm saying is there's a lot of things that you need to be updated with. Okay, and there's no way of either by you doing your own research, or you keep yourself by reading other people's research. There's no better way than you yourself having the real experience doing research. By research mean you start off with a canvas kosong, you tak tahu, okay, you just guided by the literature there and there, but you do it yourself. Trust me, the experience is so different. Okay, you become a different doctor after you do such major research. Okay, because the disease is you so focus on that particular disease. Yes, in the end of the day, you need to focus on that particular illness. Okay, so that you updated on that particular disease, so that you know in that country, okay, there are people that can help you when you get stuck. Okay, otherwise you cannot, and you should not be the jack of all trades. Okay, you cannot be good in everything. It's impossible, and it doesn't make sense for you to become good at this, that. No, okay, you just need to decide what kind of doctor you want to be and be real good in that. Okay, that's enough. Okay, that's enough. That's, to me, is what is the most important thing. Okay, otherwise there's no way that you can read all journals in the end of the day. Right? It doesn't make sense, and you should not do that. Okay, that's not how you should be as a doctor. You just need to be good in the things that you're supposed to be good. Okay, you know how to treat hypertension. Okay, you're expected to. Okay, but your own niche, you really need to know from the A to Z. Okay, so people call you and ask your opinion, you can give the proper opinion. Okay, that's in the end, that's what you should be. Okay.
All right. We do have a question from our audience, which is, will the discourse regarding the parallel pathway of cardiothoracic affect internal medicines too in the near future?
No lah, I don't think I know much about the discourse of cardiothoracic. My personal opinion, I hope the surgeons are not on this Zoom. No, kan? No, okay. I think it's more of okay, rather than through vigor of training our own candidates. Okay, to me that's something that I will ignore. I don't want to be entertained with. But no, like it would not interrupt with our internal medicine. Like I said, passing your MMed or passing your MRCP doesn't mean that you're going to be good physician. Yes, you have the credential, okay, fine, but the journey doesn't stop there. Okay, so I don't have issues with either MRCP or MMed. Okay, as long as you are been trained, okay, 4 years to you are under our umbrella. Okay, you do this under this consultant, we're fine. Okay, you're going to be a reliable physician. Okay, but reliable physician doesn't mean a good physician. Okay, you're reliable doesn't mean you want to be something like that lah. But I don't think the cardiothoracic thing is going to interfere with our own physicians training program.
All right. We know that doctor currently being a specialist in private sector. So what's the difference of becoming specialist in government and private sector?
I really like the question. Okay, you never know how good you are as physician until you are on your own. Okay, you don't have housemen, you don't have medical officers, you don't have your juniors consultant. Okay, you are the only one. Okay, from the simplest disease to the most complex illness. Okay, and it reflects on how you must be good in your financial preparation when it comes to disease. Okay, in private, you would realize you can do so much more because money is not a problem. Okay, if you come with this illness in this particular night, I can give you the right medicine, no matter how much it is, so that if you're going to die, you're going to die. But you receive the treatment already. There's nothing much that we can offer. So I get the satisfaction behind that because you know you already did your best, whatever best mean. Okay, so in private, we don't have issues when it comes to getting the best medicine. Okay, don't get me wrong. There are a lot of antibiotics, but there will be the best antibiotic for that particular patient on that particular situation. All right. So that kind of thing is not going to be limited in private because financially you have access to get it. Okay, that's the difference between practicing in private and in government in terms of accessibility to drugs. Okay, so I get the satisfaction, but you only know how good you are. Not to say that I'm good, but at least if you can stand on your own, okay, without having to rely on your houseman or your MO to get the history, to get the result, to do the examination, okay, you do that all on your own, and your patient survives, okay, it reflects on how good your clinical skills are, okay, how good your thinking process are. That's to me is everybody's in the private practice satisfaction is, okay, because you are on your own. I'm not saying that. Okay, so after I'm here, okay, we have stopped sending complicated issues to government. Okay, so all this while kita ingatkan, oh, complicated case saja hantar government. Okay, I had that impression when I was in government. Okay, but you want to change that. When you are in the private, okay, we don't want to do that. Okay, nak mati je baru hantar government. No, okay, there's no such thing as that. Okay, the only problem that we will send to government is bila insurans dah habis duit. Okay. Even my colleagues understand, okay, insurance habis saja, we need your help in terms of continuing the treatment. But while they are with you in the private, you already investigate properly, fast, proper, and you do proper investigation so that you already have the diagnosis. You just need to continue the treatment, okay? I'm fine with that, okay? But that's the good things that I feel and I get compared to when I was in the government, okay? I hope that answers.
Yeah, Doctor, yeah, you answer it. I think maybe we take the last question lah. Are
Right.
there any common misconception about the journey to become a physician that you would like to address?
A common misconception about a journey to becoming a physician?
Yeah.
Oi, maybe the person who asked the question want to elaborate more. Misconception. What kind of misconception? I can't really dwell into the gist of the question. What kind of misconception?
I'm not sure regarding that because it is an anonymous question.
Misconception? How can you have a misconception if you want to become some
Maybe like earning more, becoming a physician.
Oh, okay. So maybe so perhaps I think I can. So yes, becoming a physician is different than becoming a surgeon. Okay. I don't like to be that's again boils down to personality. Okay. If you are a surgeon, you have emergency, you must be there and then. Okay. I don't like that kind of idea. Okay. So becoming a physician, most of the time you can dwell with the issues by just giving your thoughts. Okay, some people pick up the phone and ask, you can give it. So I'm fine with that. I don't think that answered the question. But again, no, I think once you decide you want to become a physician, you already know that you're not going to be richer than your cardiothoracic surgeon. You're not going to be richer than your ops and gynae. Okay, I think you already know. Okay, when it comes to making money, please don't do this because of duit. Okay, yes, it's fine to have duit. Okay, you can buy Lego lah. What I'm trying to say, don't use money as a motivation alone why you want to do this, okay? Because in the end of the day, as cliche as it sounds, that doesn't mean anything, okay? The kepuasan from your passion too is the most important thing, okay? But I think once you are in the physician track, I know you're not going to make more money than your surgical colleagues or any other of your colleagues procedures, okay? But if money is your driving factor, fine. Okay, I can relate to that. Okay, in internal medicine, there are subspecialties that will make more money than some other subspecialties. So in general, any specialty with procedure. Okay, cardiologist with your angiogram. Okay, respiratory with bronchoscopy. Okay, gastroenterologist with their scopes. Okay. Nephrologist with the dialysis. Okay, I can think of these four who makes more money than the rest of us. Okay, infectious disease, I just kata bagi platelet je lah. You don't going to make money with that. Okay, but that's not why we're doing this. We're doing this just because purely number one, you want to give satisfaction to your patient. Okay, that should be your own driving factor. Okay, you in the end of the day, you want to help them and makes them better. Okay, although they're not your family, although they're nothing to you, okay, but they are your patient. Okay, try to make that as a driving factor why you want to do that subspecialty. Okay, the other thing will come later, right? Will come after that. So perhaps that's the misconception that so when I was doing the internal medicine training, I never have such perception. Don't get me wrong. So I can't really answer that question because we already know what we want to. Okay, if you want to, if I'm looking after money, so I'll be talking about other things by now. Okay, I hope that answers.
Yeah, all right.
There's one question, Abi question.
Yes.
Doctor, if you have any advice.
Maybe I read the question. Hi, doctor. If you have any advice that no one ever told you, what are the advice that you really wanted to give to everyone who is on the journey to become a reliable and safe doctor?
Wow. That no one ever told you. That's a deep question. I don't expect that kind of question. Okay, so my only advice is only you know what you want in your life. Okay, only you know what you want in your life. If you see medicine as a job, that's going to be wrong. Okay, it's going to be your life. Okay, it's going to define of who you are until you die. Okay, so do it properly. Okay, just because you want to do this, okay, not because other people ask you to do this. All right, because you want to do that. Okay, that's your calling lah. In the end of the day, that's what you need to find now. Okay, it's going to be a long process. Fine. Okay, but you need to appreciate what you face every day so that will answer that kind of question. Okay, you need to understand the process and understand why you're going through this. Okay, why you're going through the hell of housemanship, okay, just because of that. Okay, why you're going the hell of training of 4 years, and not to mention it's going to be tough, okay? It's going to be challenging, okay? But that's a good challenge, okay? If you have no challenge in life, that's not a good life, I would say, okay? So those challenges should make you become a better person, a better doctor, all right? So use that challenges as a good driving factor, okay? You can use that challenges as something that's going to suppress you. You can, if you want to, okay? But what I'm saying is once you put your foot down, okay? Do it properly, okay? Do it properly because you want to do that, okay? Not because you expect somebody expect you to become like that, okay? If you manage to do that, I think you should be okay as a doctor, okay? I think you should be okay as a physician, all right? Yes, I think nobody advised me that before. That why anybody ask me that kind of question, that is the answer that I will give, okay? Because you're not going to learn this from others, okay? You can get the impression from others, okay? That's important. Get the impression from others, and you know that impression is correct, is right, and follow that kind of figures, ideas, okay? So that should guide you lah.
All right. I think we come to
it's okay with that question.
Yeah, I think we come very very good advice from doctor, and I think we come to the almost the end of our session. So as we draw our webinar pathway to becoming a physician to a close, I would like to extend a heartfelt thank you to our esteemed panelists, Dr. Muhammad Yazli Yuhana, for sharing his invaluable insights and experience with us today. Throughout these sessions, we have the privilege of delving into the intricacies of the medical career pathway, from the foundation stage of medical educations to the decision involved in choosing a specialty and the ongoing commitment required for professional developments. Dr. Yazli's journeys marked by rigorous training, international experience, and significant contribution to infectious disease and clinical tropical medications and medicines has provided us with a rich tapestry of knowledge and inspirations. So the key takeaways for today is, first one, we need to know what we want for ourselves. If let's say we are doing things that we not interested, it will be very tiring. The second one is continuous learning and adaptability. This session also highlighted the necessity for continuous education, no matter how old we are. So I think it's been a truly enlightening sessions tonight. For those looking to further explore a career in medicine, we hope that you gain something throughout these sessions. For information, we will upload the recorded video and send it to your email after this session. So before we end these sessions, maybe our audience, do you guys can open your cam so we can have a group photo with Dr. Asli together? Yeah. And our secretary, Haris, will be the one taking photo.
Right. You guys can open up your camera. Okay. Ada lagi. Because this, by the way, doctor, before this kita ada buat satu session juga for surgeon punya pathway. And this your internal medicine pathway will be our last webinar session lah. Yeah. Alright.
So by now, berapa orang nak jadi surgeon, berapa orang nak jadi physician?
Saya surgeon lah.
Oh, you know, fine doesn't matter, okay? As long as you want that, that's important.
Then, alright. So semua dah buka. Okay, ready everyone? 1, 2, 3, smile. Just keep smiling. 1, 2, 3. And last one, freestyle. 1, 2, 3. All right.
Okay.
All right. Once again, I would like to thank you everyone for attending tonight, and also thank you, Doctor, for your time, for sharing your insight to us. We hope that these sessions are helpful and inspiring, and we do provide a QR feedback form. Please help us to fill in for further improvement. So stay tuned on UNIMED Instagram for more webinars and others upcoming events. I wish you best of luck in future and have a wonderful day. Goodbye, everyone, and thank you once again for joining us. Thank you, Doctor.
Thank you, guys. Have a
Thank you,
good
Dr. Yazli.
Thank you, Doctor.
Thanks.
Thank you, Doctor.
Thank
Thank
you.
you, Doktor.
Semoga your TikTok makin banyak followers.
Yeah,
Alright,
Dr.
thanks.
Lego. Yeah.
Thank you,
Thank
Doctor.
you, Doctor.
Thank you, Doktor.